So let's take a moment and let me take you somewhere. Now, maybe days, months, or even years from now, you're a hotshot surgeon. You've performed a massive surgery, a very cool procedure, but now your patient is in recovery. From the recovery till the point your patient goes back to home, you are responsible for your patient, for the management of his nutrition, for the management of his condition. You have done the surgery now. You cannot reoperate, or you should not reoperate at this point in time. But now you have to resuscitate the patient. You have to maintain the caloric intake. You have to maintain the body temperature. You have to maintain the body output. You have to carefully weigh the body input. You have to see what is going in and what is coming out and how the metabolism of the patient is going on. In this presentation, we'll be talking about the nutritional status of the patient and how to manage surgical nutrition and metabolism. This lecture has been divided into 5 sections. In the first section, we'll be talking about the basic metabolic principles. The basic metabolic principles are important because they give you an idea of how the basal metabolism works in a patient, in a generalized population, what are the specifics of this patient in particular, and how you're supposed to manage them. Now, in the second section, we'll be talking about the nutritional assessment. That is how you can nutritionally assess a patient. What are the parameters? What are the scales? What are the methods that are used for nutritional assessment? How accurate these methods actually are? Can they be used in unison, or multiple methods have to be used at the same time? What is the sensitivity and specificity of these methods, and how frequently are these methods used? In the third section, we'll deal with overfeeding and malnutrition. So these are the two extremes on the seesaw of nutrition. First of all, we can have overfeeding. That is, you're giving more than what is required to a patient. Then we can have malnutrition. It can be categorized as less than what is required is given to a patient. So we'll see how overnutrition and malnutrition might affect a surgical patient. We'll also see what they do in a normal individual, and when this normal individual, whether be it an overfed individual or a malnourished individual, comes to you for an elective or an emergency procedure, what happens to the basal metabolism of this patient. In the fourth section, we'll be dealing with substrate metabolism changes. We'll see what does the surgery do to the body in terms of metabolism. Keeping it short, surgery is a major stressor, be it an elective surgery or an accidental surgery. So we have 3 basic elements of nutrition. These elements are carbohydrates, the proteins, and the fats. We'll see how the metabolism of all these 3 elements are changed in the presence of a stressor, that is surgery. Now, in the last section, we'll talk about other stressors which cause an adjustment in the metabolism of carbohydrates, proteins, as well as fats. In this section, the stresses we'll be looking upon would be an elective surgery. Then we'll talk about sepsis. Sepsis is the widespread of bacteria in the body. And then we'll talk about chronic conditions. These chronic conditions include cancer and acquired immunodeficiency syndrome, also known as AIDS. So I hope you're excited about today's lecture. Keep in mind, you want to become McDreamy or McSteamy, but you'll have to learn the nutrition, because nutrition is what will make you a good surgeon and a good physician. So I hope you're excited about today's lecture. For further such lectures, keep watching sqadia.com.